Hi, my name is Christina Turner. I'm the Member Services Manager at the Ventura County Healthcare Plan, and I'm just going to give you a summary today of the benefits, and as Jennifer mentioned, I can answer any questions at the very end. So we are one of the options for county employees. That's both for active and retired employees. We also provide coverage to some of our clinics, the providers and staff at those offices, and then we're also an option for the Sheriff's Association. So Ventura County Healthcare Plan, we're an HMO, and what that means is you do need to select a primary care physician, and that physician will coordinate your care. So if you need to see a specialist, the primary care physician will coordinate that for you. There are exceptions to that, which would be mental health and substance use. You do not have to go through your primary care physician for that. You can self-refer, and also women can self-refer for OB/GYN services. All of your family members who are on the plan can select their own primary care physician, and you can also change primary care physicians at any time. So you can just call up my team and we can change your primary care physician, and it can be effective immediately. You also have coverage through Express Scripts, and that's our prescription vendor. That's just to go back on the medical, it's an HMO plan, and we're the service areas of Ventura County. So all of our contracted providers and hospitals are within Ventura County. If you have covered dependents outside of the county, then they would be covered for emergency and urgently needed services only. So for example, if you have a child in college, they would need to come back into Ventura County in order to get their preventative care services, maybe their annual checkup. But if they have an accident or something and they need urgently needed services, they can access those nationwide. For our pharmacy benefit, it is national. So Express Scripts has on their website all of the contracted pharmacies. So if you have a child in school and they need medication, they'll be able to get that outside of the service area. Optum Health is the vendor for the mental health and substance use. It's also known as Life Strategies. And again, you can self-refer for those services, and a little bit later we'll show you the website. We have a link on our website that links you to both Express Scripts and Optum, so that you can go directly onto their website and find a participating provider or contracted pharmacy. And then we also have the Nurse Advice Line. That's a free service. It's available 24 hours a day, 7 days a week. It's there for you. It's a great tool or great option if you're maybe on the weekend and your PCP isn't available. You might have a child who has a fever. You're not sure if you need to go to urgent care. You can call that Nurse Advice Line, and a registered nurse can help you walk you through and decide the appropriate level of care. So it's there for you, and it's a free service. And then I'm not going to go through this benefit summary. I know it's probably pretty hard to read anyway, but hopefully you picked up a more comprehensive listing in the back, and also our quick reference guide. But I'll just talk through a little bit of it. Again, this is an HMO plan. There's no deductible, so you don't have to pay out of pocket before the plan will start to pay. There is an out-of-pocket maximum, $3,000 individual, $6,000 for family, and that's really there for your protection. So anytime you're paying out-of-pocket for covered services on medical, prescription, or behavioral health, all of those go towards your out-of-pocket maximum. And once you reach $3,000 per individual, $6,000 per family, the healthcare plan is going to kick in and pay 100% for the remainder of the year for any covered services. So it's really there for your protection. It's really hard to get there with an HMO, but you could have situations where maybe you're in the hospital or you have high prescription costs, and once you reach that maximum, you'll know you won't have to pay any additional for covered services. So for those of you on the Ventura County Healthcare Plan already, there's going to be no change to our benefits. So everything that you're currently getting today, the copays will remain the same going into 2019. Some of the main ones, your primary care physician, if you're going to a VCMC provider, it's going to be $10. If you go to a specialist for VCMC, it's going to be $20. And then outside of VCMC, a contracted provider would be $20, and then a specialist would be $40. The urgent care copay is remaining at $50. Emergency care is still at $150. And just to remind you, on preventative care, that's a $0 copay. That includes immunizations, if you have your annual physical, well woman exams, also your screening mammograms, your colonoscopies, all those are considered preventative under the Affordable Care Act, so that's a $0 copay. Just to caution you, if you're having like your annual physical and you go in and you're talking about other issues you're having, then that could turn it into a non-preventative, so then your copay would apply. So just keep that in mind when you're going to those visits. We also have a couple what we call ancillary coverages. Forgot to mention in the first session, but for vision, we do offer a $50 out of reimbursement for members for your annual eye exam. So this is whether or not you have MES vision coverage. It's an up to $50 reimbursement. So for MES, your exam is $20. So you could submit that on one of our reimbursement forms and get that reimbursed to you, that $20. If you don't have vision coverage, we would reimburse you up to $50. You just need to submit your receipts up to the Ventura County Healthcare Plan. And then we also have chiropractor and acupuncture coverage as well. That's a reimbursement benefit. You can go to any of those, any acupuncturist or chiropractor, and get reimbursed up to $20 by the plan for up to 15 visits. It's combined 15 visits for the acupuncture and chiropractor together. This is just a listing to show we have the VCMC providers. We have numerous providers, specialists, hospitals within the VCMC system, and then we also contract directly with additional hospitals and pharmacies and providers and specialists. Really encourage you to go onto our website. That's the best place to go if you're looking to see if your providers within our network. The printed directories are pretty much out of date the date they're printed. We update our website on a weekly basis, so it's really up to date. You can search a variety of ways. You can search by specialty, you can search by zip code, city, gender, language. So really helpful tool if you're trying to figure out if the physician that you have is in our network, or if you're looking for a specific specialty. As you can see, there's an Optum and Express Scripts place on our website. You click on those and it'll take you directly to those websites. Really encourage you to go into those websites and create an account, because then you can, kind of look and see what your benefits are. You can look at where their providers are and get some good information that way. My team is available Monday through Friday, 8:30 to 4:30. So you can feel free to give us a call if you have any questions. You can also look on the website.
Hello. My name's Jessica Nixon. I'm with BlueShield of California. I will be the account service rep for this account. So thank you guys for having me. I'm going to go through quite a bit, actually. There's a lot of changes coming for you guys. So I'll do the best I can to explain everything, and then I will be here afterwards if you have questions. So first off, I want to make sure everybody grabbed one of these and one of these. Okay, so everything that I'm going to talk about will be in here with the exception of your actual benefits grid. So you don't have to write anything down. Most of it's in here. And then this is just a handy tool for helping you find doctors. Okay. So I'm going to talk a little bit about BlueShield first, just so you know. Our mission is to make sure that all Californians have access to high quality, affordable health care. Affordability, emphasis on affordability, right? Our networks, we have an HMO network that has 40,000 physicians and 350 hospitals. Our Trio HMO, which we're offering to you guys today as well, is available in 24 counties in California, and it is continuing to grow. We are also offering you a full PPO network. So we have 73,000 physicians and 378 hospitals. For those of you looking at the PPO plan, it is part of the Blue Association, so that's what this Blue Card network means. You will have access to all of the Blue Cross Blue Shield providers in the entire United States. We'll talk about that a little bit later. All right, so there's a lot of different plan offerings that we're bringing to you guys today, so I'm going to hopefully explain them to you. And if you have questions, I'll be here. So we're offering an HMO network. So an HMO, it was already talked about a couple times. You need a personal physician and you need a medical group. You need to be assigned to one. Your dependents in your family do not have to be in the same medical group as you, just in the same plan that you're under, right? For HMOs, you need referrals, authorizations, but it comes at a lower cost for your co-payments. And we'll talk about that in a minute. A PPO plan it's the opposite of an HMO. So you can really go anywhere you want. You can go in network, out of network. You don't need a referral. You don't need an authorization. You don't need to be assigned to a doctor, but it does come at a higher cost. So the benefits, once we get into those, you'll see that it's going to cost you more out of pocket to use a PPO plan. Right now you're coming from an EPO. So just to kind of level set where that falls into this set of plans. It's basically a PPO, but no out-of-network benefits. Okay, so if you're looking from the EPO and coming in to BlueShield, the PPO would be most similar to what you have, but it has out-of-network benefits as well. So now, the difference between the two HMO plans that we're offering to you. So we already talked about how the HMO, you need to be assigned to a medical group, you need to be referred and authorized. Both of the Access Plus HMO and the Trio are the same with that respect. The difference between the two has to do with the network options for one. So our Access Plus HMO offers you all of our HMO medical groups in the whole state of California. But you only need to be assigned to one, and your family, they get assigned to one as well. Our Trio network is our accountable care organization. We have select arrangements with certain medical groups that coordinate care in a way that's a little bit different than what a standard HMO would. We have SeaView IPA here today. They are our partner in this area for our ACO Trio network. Also, if you are on Trio, you have access to a concierge customer service. So it's exactly what it sounds like. They can help you with medical record transfers, making appointments. They have nurse advocates, they have clinical specialists, they have pharmacy reps, all of those on the team. And they have a unique relationship with our medical groups that can help facilitate your care as well. One more thing on the Trio that I didn't mention earlier is that the employees have access to a Fitbit walking device. So if you enroll into Trio, you'll get a welcome kit that tells you how to get your Fitbit tracker. So I'm going to go a little bit more in depth on the Trio ACO just so you understand it a little more. So our ACO is considered an accountable care organization. I know it gets referred to as a narrow network, but I refer to it as a high-performing network. So we partner with these medical groups in a way that's unique. And the example that I always use that help people understand is that we evaluate all of the providers in our accountable care organization, and we look at certain quality measures, and we look at certain inpatient stays and kind of benchmark them. We found that one of our medical groups had a 2-day longer stay than most of the other medical groups. So we partnered with them, we went in and made an evaluation and found out that they didn't have a hospitalist on Saturday and Sunday. So patients were staying in the hospital longer than they needed to. They could have been discharged, but nobody was there to discharge them. So we helped them get a hospitalist on the weekends. Sending patients home more timely means that they're more healthy. Nobody wants to stay in the hospital longer. You have more risk of infection. But we also saw a reduction in hospital stay, which also results in a reduction of premium, right? So instead of incentivizing providers on paying them for the services they're doing, we're incentivizing them for improving quality of care. So that's what's really important with Trio. Up here are our benefits for the two plans. I'm going to go side by side. Our Trio HMO ACO is on your left, and the Access Plus HMO is on the right. Both of these plans have no deductible, right? So you don't have to pay anything out of pocket up front to meet a deductible. The copay for a Trio doctor, just to see your regular PCP, is $15. On the Access Plus HMO, it's $35. So it has a higher copayment for the Access Plus HMO. For specialist visits, if you've been referred by your personal physician, it's $15 on the Trio, or it is $35 on the Access Plus HMO. So if you've got a referral, same copay. We do have a unique benefit called a self-referral benefit. So what that means is you can self-refer yourself to a specialist within your medical group. It is a little bit higher of a copay, so it's $20 on Trio, and it's $40 on the Access Plus HMO. So the example of that, which I used earlier, is that your arm's broken, You've already been to urgent care. They said your arm's broken. You need to see an orthopedic. You don't need to stop at your personal physician for him to say, I think your arm's broken. You need to see a specialist, right? You can go right to that orthopedic. You pay a little bit higher copay for that first visit, but you're bypassing your personal physician that first step. For preventive care services, those are your well woman, your annual physical, your child exams, immunizations. Those are all covered at 100%. You have absolutely zero copay for those. It was mentioned earlier, and it is true with us as well, that if you go in for your preventive care, but you mentioned chronic headaches, you now have a copay. So you want your preventive visit to be just preventive care. Inpatient hospital stay on the trio is $100 per admission. So it's not per day, it's per admission. On the Access Plus HMO, it's $500 per admission. So it's a higher copay on that plan as well. Ambulance services are $50 for your trio and $250 on the Access Plus HMO. Emergency room copays and services are $100 on both of the plans, but it is waived if you're admitted. So you won't pay that copay if you end up staying the night. On to prescription drugs, we have a tiering system. So tier 1 is mostly generic meds and some low-cost brand. Those copays are $10. Tier 2 is our brand name medication mostly, and there are some high-cost generics that fall into that category as well. It's a $25 copay for those. Our tier 3 is non-formulary. So I generally say that if it has a commercial with a celebrity, it's most likely a non-formulary med. It's stuff that's new to the market, not as widely recognized or used, and there's usually equivalents that do the same thing that are already on the market. So that is a $45 copay for those medications. Specialty drugs are medications, usually injectable meds. They get shipped by our specialty vendor. Those have a 20% coinsurance up to $150 per fill. All of these go towards your out-of-pocket maximum. So every one of these co-payments, including the prescription and the specialty, go towards out-of-pocket. For an individual on either of the plans, it's $1,500 or $3,000 for a family. So if you have a really bad medical year, $3,000 for your family is worst case scenario. We do offer a mail order prescription drug plan as well. It's through CVS Caremark. You can get a 90-day supply for a 2-month copay. Our chiropractic and acupuncture benefits on both of the HMO plans are the same. You have 30 visits that are combined. So you can do all acupuncture or all chiro or split them down the middle. It's a $15 per visit copayment, and that's through American Specialty Health Plan. So it's not part of your medical benefits. You don't need a referral, anything like that. So we're going to talk about the Access Plus specialist referral that we just talked about a minute ago. Remember our broken arm? Your ID card, whether you go on the Access Plus or the Trio, will have an indicator on it that says you can self-refer. So for our Trio, it will be a T plus on your ID card. And for our Access Plus HMO, it will be an A plus. Okay? So that just lets you know that you have that option to self-refer within your medical group. Anybody here have a college student out of state? What's not out of state? Out of state? What state? Okay, this is really small. I don't see Idaho. Is Idaho on here? Yeah. Yes. Is Idaho blue? No. Okay, so I'm sorry. They have to move states. So the states that are in blue here, they participate in our away from home care. What that means is if you're on an HMO, the Trio or the Access Plus HMO, either one, if you have a dependent residing in one of the blue states, they can become a guest member of that state. They get their own ID card, they get their own personal physician, and their own suite of benefits, which includes everything. It includes inpatient, outpatient, labs, x-rays, all of that is included, okay? What you would do is contact our customer service department if they're in one of these states, and we would fill the application out for you and get that dependent enrolled in away from home care. So that's just an option for some of you that may have students out of the state. If they are in one of the white states here that are not part of the blue, then they would have access to urgent, emergent, and prescription drug coverage. Right. Moving on to PPO. So the PPO plan that you have now is only in-network benefits. So I'm going to go through your in-network benefits, and then I'll talk about out-of-network, okay? So in-network, you will have a $3,000, well, in and out of network, you have a $3,000 deductible for an individual or $6,000 for a family. Now, if one person in your family is really sick that year, they're not meeting the full $6,000. They're just going to meet an individual deductible of $3,000. Okay, so it kind of protects you from one person being sick and the rest of the family being healthy. Once your deductible is met, you're responsible for a percentage of your services. So most of the services are covered at 20% coinsurance. So we pay 80, you pay 20. Preventive care is covered at 100%. That's pretty much standard across the board. You don't pay a deductible for that. Prescription drugs are subject to the deductible as well. We use CVS Caremark network. It's Walgreens, Rite Aid, Costco, Walmart, all the pharmacies you're used to are in that network. Your copays are $10 for tier 1, $30 for tier 2, $50 for tier 3, and your specialty meds will be 30% up to $200 per prescription. There's mail order on this as well, so you can get a 90-day supply for a 2-month copay. If you go out of network, and I'm going to say, well, it's going to be hard to go out of network, but if you choose to go out of network and you end up out of network, you're responsible for the same deductible, but your coinsurance goes up to 40% for most of the covered services except for an emergency, okay? And then you're responsible for anything above what's allowed. So anything above our negotiated rate is considered non-covered. It won't go towards your deductible, it won't go towards your out-of-pocket, it'll be completely on your own. So if you go out of network, be very cautious, make sure you know what you're being charged up front. If you use an out-of-network pharmacy, there will be a 25% coinsurance tacked onto your copayment as well. There's chiropractic and acupuncture benefits on this plan. You have 30 chiropractic and 20 acupuncture visits per year, and there is a 20% coinsurance for those services after you've met your deductible. Again, our PPO plan is part of the Blue Card network, which means no matter what state you're in, you can use it. Just make sure that the providers are affiliated with the Blue Cross, Blue Shield of that state. Okay? So if you're traveling to Idaho, I think it was, you just say, I'm with Blue Cross, Blue Shield of California, I need the Blue Cross, Blue Shield of Idaho network. Okay? And you'll get all of your benefits in network. There's information here on how to find those providers. But I encourage you to call us ahead of time and we'll get you a list of providers before you travel. All right, so how can we help you guys manage your health plan for your family? We've got a couple different things that come along with these plans. First of all is our Nurse Help 24/7 line. It's the same thing that was mentioned earlier. It's a nurse line. It's open 24 hours, 7 days a week. It is free of charge. The example that I use, my son had these sores on his arms. I couldn't figure out what they were. My husband said put water on it because that's his cure for everything. I called Nurse Help, and Nurse Help says to draw circles around the sores. And if they're bigger in the morning, then he needs to go to urgent care. So I did that, and they were bigger in the morning, and we ended up at urgent care. He had staph infection. So if Nurse Help wasn't there to settle our marital dispute, my son could have lost a limb, who knows? But that's what Nurse Help is there for, okay? Sick baby in the middle of the night, high fever, how do I bring it down? It's free. The number will be on the back of your ID card. So here's another thing that comes along with us, helping us manage care for our family. We offer Teledoc. Teledoc is a telephone, computer, or app-based visit with the physician. On the HMO, it's a $5 copay. On the PPO, you'll pay $40, which goes towards your deductible, and then $8 after your deductible is met. The story that I tell with this one, my daughter, I come home, I live in Lake Arrowhead, which is nowhere, and my daughter had a sore throat. So I got on my Teledoc app, doctor popped up within a few minutes, and we FaceTimed him. He looked down her throat, had her do some throat exercises, and said, I think she has strep throat, which I already knew because I'm a mom, I know everything. So he wrote us a prescription, sent it to the local pharmacy, and gave us a note for school the next day. So I didn't leave my house, my daughter was treated, didn't deal with the cold, didn't deal with sick anybody else. So that's Teledoc. It's an amazing benefit to you guys. Some of the top diagnoses that they can diagnose over the phone, of course, sore throat's on there, pink eye, bronchitis, urinary tract infection. I don't know if they have like a dipstick app or something you can use, but they can diagnose a UTI, that's for sure. They can also go over test results. So if you're like me, you get test results in the mail, you have anxiety, you're Googling, just call Teledoc. They can help calm you down before your next visit. All right, so we've covered nurse help, we've covered telephone visits. So we also have something called life referrals 24/7. So this is kind of like a built-in employee assistance program that comes with your BlueShield plan. My son recently was married and divorced within a month, and I needed assistance because I didn't know what to do. So, and he's military. I called life referrals. They actually got me a military specialist attorney to give us a consultation for what my son needed to do with his military benefits, all of that. And then if my son needed further attorney services, he would get a discount after that. So there's a lot of great things that go along with this. If you just need some maybe counseling services just for a minute, maybe you've had something stressful happen, you can get a few visits covered. There's parent and child care resources as well, and legal mediation, which we talked about, and identity theft assistance. We know that's happening a lot. All right, so how can you get the most out of your healthcare dollars? We talked about preventive care services. Please get them. They're free. They're covered. Do that every year. Make sure you're getting your immunizations as well. Prescriptions, take advantage of the 90 days where you can. If it's a maintenance med you've been on forever, go ahead and do mail order. It comes right to your house and you're paying less copays. You can also join some of our support programs. So if you've been recently diagnosed with maybe cancer, you can get a clinical nurse, case manager to follow you. We have prenatal programs. We have pre-diabetic programs as well. We want to keep you from becoming a diabetic. So make sure that you know what programs are available to you and take advantage of those as well. We offer wellness discount programs. So let's say you've exhausted your acupuncture and chiropractor, you can continue those services at a discounted rate. We have weight management programs such as Weight Watchers, Jenny Craig. We have an exciting exercise program that's going to be coming out at the first of the year, so I encourage you to look out for that information. Vision will be up to talk a little bit later, but if you've exhausted your vision benefits, we do have discounts on frames, lenses, and photochromatic lenses as well. So how do you get started? Find a doctor. So that's what this little video card is here. If you have a QR reader, just scan that. If not, the website's on there. You want to make sure when you're looking at a plan, which network your doctor is in. Are they on the PPO plan? Are they in the HMO? Or are they in SeaView, which is part of our TRIO network? Move along. If you're on the PPO plan, if you're looking to go into the PPO plan and you find out that the doctor that you're using currently is not in your network and you have an ongoing treatment, then you will be eligible for something called a continuity of care, which means that you can continue with that out-of-network doctor until you're safe to transition back into a planned physician. So just keep that in mind. This is something customer service can work with you on. You would need to call them directly when you get your ID card. Also for the PPO, if you're looking to bring over that deductible credit that you've already met this year, we can do so. It's not automatic for us. So get an explanation of benefits from Anthem and provide that to us after you get your ID number, and we will give you that credit for your prior carrier accumulations. Prescription drug transfers, make sure that you're filling your medication before you move into BlueShield, just so that you have at least that 30-day supply so you're not caught off guard without medication. You can transition your mail order as well. So if you're currently on mail order, just give a call into our customer service. And if you're on the concierge, they'll set that up for you as well, just to get your 90-day supply going. Continuity of care for prescriptions, we're doing something for the first 90 days where we call it an edit lift. So if our medication's already required an authorization and we don't know you've been on the medication, we're just gonna lift those requirements for 90 days. So make sure you fill your maintenance medications. That way there's no disruption in care. If after the 90 days you go to fill a prescription you've always been on, we may require an authorization and that could delay some things. So make sure you're filling your medication timely. All right, so what to expect December 30th. So you've chosen BlueShield, now what? We're gonna be sending out welcome letters. The welcome letters actually will have your ID number on them. They're gonna give you advice on how to register, get set up online to get a temporary ID card, because those will be available. Make sure your PCP and IPA is correct. If they're not, don't panic, we can fix it. Just give us a call, we will set you up with the right physician and send you out new ID cards. Also notify your pharmacy and your providers that BlueShield's new. They often get the blues confused, I do it too, but let them know it is BlueShield of California, it is no longer Anthem. Whoops, I hit that too fast, sorry, let me go back. Whoop, whoop. There we go. So all of the information we talked about today is available on the BlueShield website. You also have access to view your claims. If you're going on PPO, Treatment Cost Estimator, there's also a map that tells you the providers that are most cost effective for you in the area as well. You don't want to get the same service at one place for 3 times higher than down the road. I encourage you to download our mobile app as well. I don't even carry my ID card anymore. It's just all on my phone. That's what it looks like. You can find urgent care, you can find chiropractics, mental health providers. It's all available right here. And last but not least is the support. Please call us. We know you're coming. So these are the phone numbers. If you're looking into the TRIO plan, please call the concierge line. They're available 7 a.m. to 7 p.m. Monday through Friday. If you're going on the Access Plus, HMO, or the PPO, they do have a separate phone line, so you can give them a call. They can help you find doctors. They can help you look at the drug formulary as well, find out where your medications fall and what your copays will be. I will be up here later to answer questions, and I'm going to pass it on now to SeaView, who is our TRIO partner.
Good afternoon. My name is Noel Frias. I'm with SeaView IPA. Jessica already mentioned a lot of things about SeaView IPA. How many of you are familiar with SeaView? There's several of you that know SeaView already. She already mentioned that we are an HMO medical group here in Ventura County. We are the exclusive medical group for the TRIO product. But we are also on the Access Plus product for the BlueShield product. So you can either choose either the Access Plus or the TRIO, and SeaView IPA will be on either on those network. I would like to also mention that once you become a member of BlueShield of California under the TRIO or the Access, they will send you the packet for your welcome packet, and also SeaView IPA will also send that packet to you once you become a member. As you know already, SeaView IPA has been with Ventura County for about 27 years, and we've been serving the county for that long. We serve a large specialty network down mostly on the West Ventura County. We serve the Camarillo area, Oxnard, Port Hueneme, all the way to Ojai. And I assume most of you live within the Ventura County or not outside of Ventura County. So if you are within this network, then you are going to, SeaView IPA will be able to serve you for those services. The hospital network that we are using in Ventura County are pretty much all of the hospital here except for the Ventura County Medical Center. So we are using the CMH, we're using the 2 St. John's Hospital, in the one in Oxnard, the one in Pleasant Valley. We are also using the Ojai Valley Community over in Ojai, and the Santa Paula Hospital in Santa Paula. So if you live on those areas, you'll be able to use any of these hospitals here. We have 7 urgent cares that we use in Ventura County. You probably pick up one of our brochures like this one here. So we have the list of all of our urgent cares inside. We also have the list of our PCP, our primary care physician, inside. At the same time, I'll also bring a hard copy of the primary care physicians with their addresses. The one in the brochure doesn't have the addresses. It's the one printed separately, have their telephone numbers and their addresses. So if you need to refer to this one, you may have to use this one also. We also have the frequently asked question about SeaView IPA, or how we process our authorizations. How many urgent cares do we have, or what facility do we use? Everything is on this FAQ, so you can refer it to this list right here. I want to go over real quick of our authorization process. We don't have to go through this one. It's pretty small images right here. Once you go to your PCP, your primary care physician determine whether you need to go to a specialist. Although you have your self-referral option, you may also choose to go to your primary care physician and discuss with your primary care physician whether you need a specialist referral. If you choose that way, then the primary care physician will determine if that diagnosis will need authorization through SeaView. They will submit that to SeaView, and we have 3 different options, 3 categories where that physician will have to determine, we have either the routine, the urgent, or the stat. For example, MRI. MRI can be a routine, meaning to say it could wait for 2 to 3 days. MRI, the doctor will determine whether that's an urgent, it needed to be done within 24 hours, or that MRI needs to be done right now. If it's need to be done right now, the doctor will call us at SeaView IPA and saying, I have a patient here that needed an MRI. We will process that within 1 hour. Within 1 hour, you will get that authorization. Regardless, whether it's a routine, whether it's an urgent, those are submitted to SeaView IPA. Once it's processed, you will receive a letter. Your physician will receive a letter, your specialist will receive a letter, and you will receive that letter of authorization. Once you receive that, then you are able to go to that specialist. Just a precaution, or just being proactive as a patient. If I go to my physician and I have submitted that, and my physician told me that I needed an MRI, and he has submitted that for an urgent for the following day, for 24 hours, I would call my physician right away the following day and ask them, have you submitted this request to SeaView IPA? Once they said yes, I can call SeaView right away and ask them, my doctor submitted a request for an MRI. Do you already have an approval? If we have an approval, we can give you that number right away. You don't need to wait for that letter to go to that specialist. You can go to that specialist right away with that number without the letter. So that's something that need to bear in mind if you use that route, not using the self-referral, but instead working in collaboration with your primary. Make sure you do that process. And lastly, I want to mention to you about our transitional care program. Once you get hospitalized, or anybody of you get hospitalized, once you're discharged, our nurse practitioner and case managers will work with you if you needed assistance at home. There is no limit of days for that nurse practitioner or the case manager to work with you, whether it be bathing, going to your appointments for your next appointment, taking your medication, or whatever that's medically necessary for you to be help for that specific need. So transitional care program for SeaView is a really good bet. There's no cost to you. One last value option that we provide to our members is our clinic at the office over at Solar Avenue in Oxnard. We have our diabetes clinic there, and also we have our anticoagulation clinic, which is for those people who are on heparin and warfarin for the blood thinners. So if you're a SeaView patient and you have those two diagnoses, you can go to the office at no cost to you, and we have nurse practitioners and case managers who will be looking for those diagnoses and care about you. If you have any problem looking or choosing for a primary care physician, if you're looking to choose for another physician that you have now, then the list that you have right now, I can go help you out later on and pick up the right physician for you within the specific location that you are living in. We have a lot of physicians, like I said, we have about 136 primary care physicians right now contracted with SeaView, and we have about 400 specialists that's contracted within the network here in Ventura County. So if you have any questions, any concerns later on, we'll be staying back and answer any of your questions. So I will give it to our next speaker. Thank you so much.